Okay, a little window into how things are at RP Center, how an institution gets the best out of residents year after year. So the importance is when you have to get something out of residents, you have to give it a priority and you have to maximize their potential. We have to realize that everybody is not going to be the same. So you have to customize and tailor-made your approach. And of course, there has to be an institutional commitment to excellence. And the RP Center, being part of the All India Institute of Medical Sciences, which was established in 1956, epitomizes that. Now, the core pillars of resident success. Now, when we want a resident to come out of the halos of our institute, we want that person to be a complete ophthalmologist, which is not only in terms of the professional skills, but also a complete human being in terms of being a human resource for teaching and also having a very empathetic attitude towards patient. So for this, there is, of course, a strong mentorship, faculty guidance, a structured and dynamic curriculum, continuous assessment and feedback, a supportive learning environment, and the effective mentorship and guidance where the faculty play a role model. And along with the faculty, we have a whole cadre of other people engaged in this teaching activity, directly or indirectly. They could even be a OT nurse. It could even be a technician who is using a piece of equipment. And one-on-one coaching, career guidance, and encouraging independent clinical decision making. That's the other thing. In the course of their day, there has to be some point of time where the person is on that point where he or she has to take the decision that this is what I'm going to do, and they should have that freedom and flexibility that if in doubt, I can go and to the next person, and I will get the guidance required. And curriculum design and adaptability, we have to balance theory with hands-on practice, and it will also depend upon each institution what is the patient care abilities or the patient care freedom available. There could be a private institute, it could be a public institute, there could be large number of patients, few number of patients, so you have to customize according to whatever is available as your resource. Incorporating latest research and technologies, customizing it, and then a continuous assessment and feedback, which would be both ways. And generally, you would like to have a supportive learning culture. This is something that came naturally to us because it's always been a tradition right from the inception. And not to forget a good work-life balance and a mental health support, which is becoming very, very important in recent times. Teamwork and collaborative learning, not only vertically, but also horizontally amongst the peers, building a culture of innovation and research, and then case studies of successful interventions. This can make a lot of difference to use best practices, and this kind of forum that I've seen in this session and the previous session is a wonderful example of learning from each other. Innovating teaching methodologies and lessons learned both from people senior to you and also from the past. There are, of course, challenges and situations. There are new age barriers in residency experience. There have to be strategies to overcome burnout and stress, not only among residents, but also among faculty. After some time, you become a bit jaded, perhaps, because you're overloaded with work and you're doing the same thing day in and day out. So you have to rejuvenate yourself and enhance engagement and motivation. And the future of residency training, there will be changes with AI applications and adapting to evolving healthcare needs. So I'll give you a few examples. It's not possible to capsule in a small time everything that we have learned over the years, but I would like to share a few examples from our center. This is just a snapshot of the annual report I presented at our 58th Foundation Day celebration on the 10th of March. And this time we thought I'd keep the theme as legacy. Why was it legacy? Because one needs to, as I said, remember what we have learned from the past. We've had several chiefs of the center, and each chief has added in some way. And now I have a position, I'm in a position of leadership myself, and I would like to, carry the tradition forward and at the same time add a little bit of my own to this journey. Just a little word about our founder chief, Dr. L.P. Agarwal. So this is what he had been given in his, when he was in England, he had been given this little bit of written thing in his recommendation of all the Indian postgraduates who have been at the Moorfield since the war. So you can understand with a very challenging time in England as well, where they had to build their own country and their own training. There has been no keener man and no man who has done better in his examinations or work harder to gain experience in every branch of the subject. I showed this because I wanted to reinforce to everybody, including the faculty, that one should know more and more about less and less. as we all do, we may be cornea specialists, retina specialists, diabetic retinopathy specialists, and so on. But we must not forget that we must also maintain our knowledge across the board in other subjects as well. That was the only purpose. And if you see, as an institution, there's a huge number of students, huge number of faculty, and a whole team of people working. But not to forget, as I said, the nursing staff and the administrative staff. So we need everybody to engage into making the whole learning experience to facilitate the residency program. We lost our chief, Professor Supriya Ghosh, last year, and Dr. Supriya Ghosh had a very one-to-one interaction with residents, and he had a little different lifestyle. So he used to work throughout the night and have a different, work culture and a different timetable. But then he could say that RP Center is truly working 24 hours, because there were some faculty who would be working in the day and Dr. Ghosh would be working throughout the night. And then we had Professor Tityal, who superannuated last year. And here again, we had a person who did a lot to improve the sort of the surgical training, and also did a lot for the residents in making new programs. So we had our anesthetists also. So this is one of the things, these are the opportunities where we think back of a person who has given a lifetime to the institute, and we have young people who are attending, and there's the threshold of their career for them. 30, 40 years seems too far ahead, but it's just a thing to motivate and to encourage them. So this is how we try to engage everybody in realizing that there should be no compromise in quality. Now, looking at patient care again, as I said, the challenge that we face now is patient care has expanded so much. Residents are very much a part of that patient care. So there'll be junior residents and senior residents. Senior residents are more for the service delivery, but they have to teach alongside. And there are junior residents who have to learn as well as deliver the patient care. And patient care has expanded to such a huge extent because the number of procedures has increased. We have daycare surgeries, which has increased, and the amount of intervention that we are offering to patients has increased. For example, intravitreal injections. And so with all of this, one has to keep the balance. One has to reorganize your workflow, reorganize sharing of responsibilities, not put everything on the doctors, start using the other staff to take care of some of the responsibilities and share the burden. We have investigative laboratories, for example, where high-end machines and equipment, you may not always be able to allow all the residents to handle one-on-one, but they are encouraged that if you have any patient who requires any investigations, try to take some time off and accompany them to see what the other person is doing. So as an apex institution of ophthalmology, we do have a lot of responsibilities. We support the other AIMS and RIOs, but we try to take with us the residency feedback from the other institutes, and also we have a lot of our students who are now the faculty in the other institutes. So we have this ecosystem of sharing and trying to bring come back to the institute and say we cannot rest on our laurels. We have to remain on top, because everything we do is in the lens of everybody else, and you're in the public eye. So for education and training, one of the key contributions of Dr. Tityal has been to help develop our surgical skill lab. So that has really been of a very nice international standard. So we have wet lab training, and we have an inbuilt system where they have to go through that structured system, then they get certified to do their ECC, and then certified for phacoemulsification, and then they're allowed to operate on the patients. And again, it is with assistance and so on. Then we have new innovative methods of quizzing and trying to get the residents involved in various activities throughout the year. Just to give an example of our training alumni from the defense services. So this is just a small snapshot. Similarly, we've had alumni training from various other institutes, RIOs, and so on. And we also do get a lot of requests for cataract surgical training through the National Program for Blindness Control and Visual Impairment. And there we have to draw a line, because we say, unfortunately, we can't support it because we have so many residents of our own, and we cannot compromise on that. So sometimes we have to know when to say that, no, we cannot stretch further beyond this point. I feel that optometry training is something which requires a certain amount of thought. There is a concept that optometrists are a competition or a challenge to ophthalmologists, but I don't agree with that view. I feel they're a very good paramedical support staff, and as we're going ahead, there should be more collaboration and making sure that they can share a lot of the responsibilities in high volume, high burden settings, and we have tried to rejuvenate our optometry training program. Nothing can be done without research, and here all MD students do a research thesis topic, and we encourage them to publish, and we have a good number of our faculty who have made it to the Stanford list of top 2% highest cited researchers. So capacity building, we like to go further and further. We're recognized as the World Health Organization as Prevention of Blindness Institute. And then there are the outreach activities, which is again a way of residents realizing and letting them stay grounded. We don't want them to only think that ophthalmology is high income, high impact only in big cities, but there is a lot of work that has to be done in the periphery, not to forget the work on eye donation and transplantation. And then we have an annual Foundation Day celebration where we give them the opportunity to have an experience of what we have today. So we would like them to be involved as speakers, moderators, and organizers. We have the various recognition of international and our own national faculty and alumni who have reached great heights, so that they know that this is something that they can aspire to. This year we had an overwhelming number of people who wanted to speak and participate. So we did the first silence conference where we could have two halls in the same sort of halls working together. And then the Teachers of Tomorrow session is another very, very successful model where we have the residents come forward and then they give little capsulated teaching, and then they are given awards at the end of that. So in all, I would say that how do we keep them engaged day after day? It's certainly requiring a lot of hand-holding, being alert as to what's happening, and a teamwork of a whole lot of committed people who are in academia for a reason. I'd like to share that we'll be organizing the Comprehensive Cataract Conference for the International Society of Manual Small Incision Cataract Surgeons this year in November, 7th to 9th. So I hope people would register and participate. Thank you.
Thank you, ma'am, for this very informative lecture, and we have all learned so much, like what amazing teaching and training program going on